Because it is a very complex system, I think nurse navigators are there to guide patients through that system. Nurses are very innovative and very good at thinking outside the box, and it's very satisfying to be able to help the patient get through to the other side and get the best outcome for them.
It's new, it's a different way of looking at the problem. In the past, whenever the hospital has discharged someone before, they've just kind of sent them home, whereas what we're doing is we're going along with them through the continuum of care.
Nurse navigators are really important in the hospital ecosystem. They're a vital link between, I guess, the hospital and community.
Our role is very holistic, it's very dynamic. One day you might be in a hospital with a patient at a hospital appointment, the next day you're out in the community working with them. You've got to know how to access different systems, you've got to be able to work across different health systems as well. So you've got to have a really good understanding of all the ailments and different health comorbidities that could impact a person and how that also affects their mental health.
It's great to be able to work with, other services as well. So it's not just the midwife navigator. You're working with obstetrics and you're working with physio and you're working with OT, you're working with social workers, child health, and lots of different services.
So I'm the Aboriginal and Torres Strait Islander Nurse Navigator. We get to work really closely with our community. We go and see the elders as well to make sure that, they know us. So, then they can tell other people that, we are trustworthy, we are here to help. We do work with a big organisation, but we work one-on-one, face-to-face, at your home, wherever that client needs help, we will be there.
Bringing the culture into the patient care is very important because, a lot of the decisions that they do make in regards to their health, of course, is based on the culture that they're from and the value system that they do have around that.
I work as a nurse navigator in the emergency department and specialise in the alcohol and drug field. What used to happen is patients would come into the hospital intoxicated, feeling suicidal, and once they've sobered up, they're no longer suicidal and essentially their substance use is not addressed. So having a nurse navigator in that position who can see the bigger picture and be open and honest and have those robust, hard discussions, and that optimises patients' outcomes.
Once the patients are discharged from the hospital, they need a place that if they have any issues, they need to know where they could lean on. So we are, I think, a part of a bridge in between the patient and the healthcare system. That's the biggest part, that the patient won't feel left alone. I think it's very important that we need to have more roles like this.
Nurse Navigators have been a very exciting initiative. It came around in 2015, 2016, and it's an initiative to ensure that our most vulnerable and complex patients are so well taken through the system and given the best care possible. Our nurse navigators in Metro South really connect well with GPs, other providers in the community, as well within the system. And I think that they do take their roles very, very seriously with expertise, commitment and amazing skill. I'm so proud of them.
I have many moments where I do feel very proud. And recently I did have a woman say to me that she was so glad that she met me. It was about, for her, building that trust up again with the hospital and feeling like she can, when she is ready, to link in again.
I think it's a great role. I think it's really good. I think it meets the needs of patients in the community. I think we do important work.
I feel really satisfied in this job, and I think my colleagues can say the same.